Thank you, Mr. President. Mr. President, I rise to speak about one aspect of the budget debate that is before us, and it involves a major program that affects the lives of not just millions of Americans, but literally tens of millions. We have debates and discussions in this body all the time about our commitment to children, our commitment to older citizens, and a whole range of folks that we're concerned about. All of us at one time or another have made pronouncements about how important it is to support children, especially vulnerable children. We also are very concerned as our parents or older relatives reach a certain age that they get the quality care in the twilight of their lives that we would expect. They're helped through a range of programs or services, obviously starting with Medicare. So we're concerned about our children, we're concerned about our older citizens. We're also concerned about the middle class. We hear a lot of us speaking about strategies or efforts to help boost the middle class and all of the challenges of the middle class. It's interesting, though, that some issues affect all three of those broad groups of Americans. One of the issue I'm here to talk about is Medicaid. It affects, obviously, children. It affects individuals with disabilities. It certainly affects older citizens across the country and indeed affects the middle class. The Senate Republican budget would cut Medicaid funding by more than $1.3 trillion, and in my judgment, this is an assertion of an opinion, but in my judgment, it would end the program as we know it because of the dimensions of those cuts. The budget would repeal the Medicaid expansion, threatening health insurance for some 14 million Americans, and convert much of the program's funding into block grants. Let me talk about seniors for a moment. We have had lots of debates about what's the best policy going forward in the budget as it relates to a whole range of issues, especially issues like Medicaid and programs like Medicaid, I should say. But I think at the end of the day, it's not your rhetoric or your speeches, it's your votes that tell where you stand and what you prioritize. We all have our own personal stories about those who have gone before us, and we, of course, always remember our own parents. But when we're talking about our seniors, we're talking about Americans who fought our wars, worked in our factories, taught our children, built the middle class, did so much for us, including giving us life and love, that we want to make sure that we're doing everything possible to provide them the quality care that they deserve when they reach that age of 65 or older. We know that Medicaid provides Medicaid provides older beneficiaries the dignity in their later years that they should have a right to expect, as well as the flexibility to design where they receive care. In my home state of Pennsylvania, over 40% of Medicaid spending on long-term care, long-term services and supports goes towards home and community-based care. Many assume that the Medicare program, Medicare, not Medicaid, many assume that program will cover long-term care. In fact, it's Medicaid that is the largest single provider of long-term care in America. Not Medicare, Medicaid. Medicaid covers approximately 40% of all long-term care services provided in the United States. 4 out of 10 people is a big number, obviously. It's lots of folks that we care about and interact with in the course of a day, whether they're neighbors or family members or coworkers across the board. And as enrollment continues to grow, more Americans are relying upon Medicaid than ever before. Medicaid is the major long-term care program for the middle class. So I'd ask that we all keep that in mind as we consider determinations that are made through the budget process. Give you one example. A man living in Philadelphia, just his example and his mother's. After her husband's passing, this individual's mom had health problems, and her health deteriorated quickly. Kidney problems forced her in and out of the hospital. She was living on a fixed income with medical bills piling up. She sold her apartment and used that money to pay for a few more years of care. Her son and his mother were using every penny they could, I should say, to help her with her care, and it wasn't enough. She needed constant assistance, and her son, as the only child in the family, couldn't do it himself while raising his own 2 children. Eventually, his mom received Medicaid benefits and moved into a nursing home in Philadelphia. Her son says he doesn't know what his family would have done without Medicaid. Paying for nursing home care would have quickly eaten his salary, and he would have had to sell his family home. And again, he was raising 2 children. Medicaid allowed him to avoid that vicious cycle. Like millions of Americans, he went to school and worked hard to get a good job so he could make a decent living. But despite being employed as a professional, without Medicaid to help his mom, he would have had to impoverish his own family, his 2 children, to care for his aging mom. This would have put his children's future at risk. Medicaid offered this individual some help, and obviously his mother some help in providing for his family and offering a way to have his mother get the care that she needed. This is not atypical. This is reality for so many families. One quick statistic, and then I'll move to children and I'll wrap up. In Pennsylvania, seniors accounted for just 10% of Medicaid enrollees, but over 22% of spending in 2011. The national numbers aren't much different than that. The number of enrollees might be around 10% or in that lower range, but the spending, because the kind of care that they received, is of a higher cost. Let me talk for a couple of minutes about children. Together, Medicaid and the Children's Health Insurance Program, which we know as CHIP, served more than 45 million children in federal fiscal year 2013, representing 1 in 3 children in the United States. So it's Medicaid plus CHIP is the health care for more than 1 in 3 children. We know CHIP is the health insurance program that impacts a lot of middle income or at least lower income families with children. In Pennsylvania, for example, just the Medicaid program covered 34% of children 0 to 18. So just a little more than a third of Pennsylvania children rely upon Medicaid, a critically important program for those children. One of the groups here in Washington that tracks programs and policies for children is First Focus. They had a report in September of 2014 where they reported that in the calendar year 2012, 47% of rural children were covered by public insurance, meaning Medicaid or Children's Health Insurance, or maybe a third. 47% of rural children covered by public health insurance, only 38% of urban children. I know that sounds counterintuitive for some here, but rural children in America rely substantially upon Medicaid and the CHIP program. So improving access to health insurance for low-income children not only leads to better health outcomes in the short run and in the long run, but it also improves educational outcomes and government savings in the long term. Compared to their uninsured counterparts, children covered by Medicaid or CHIP are more likely to complete, I should say, high school and college. These important programs help children literally succeed in life because they stay in school, whereas they would not at that rate if they were uninsured. Some claim that Medicaid is a highly inefficient program. That's one of the charges against it, whose costs are growing out of control. In fact, Medicaid's cost per child are 27% lower per child than per child costs for private insurance, and Medicaid's costs, I should say, plural, per beneficiary have been growing more slowly per beneficiary costs than under private coverage. I would argue it's not only efficient, but effective in delivering quality health care to our children. But we know there's more to be done, and we know that there are improvements that Medicaid could incorporate. We need to improve dental and behavioral health care for children and increase access to screenings and vaccinations to make sure our children are protected. Let me just close with a couple of observations about children and pregnant women. We know that Medicaid is also important, in addition for children, very important for pregnant women, with prenatal, labor, delivery, and postpartum care. Nationwide, Medicaid finances 45% of all births, 45%. So we have a lot of folks in both parties that say how much they care about pregnant women and children. Well, if 45% of all births are in Medicaid, we better protect Medicaid. Vitally important. Children who have health insurance like Medicaid and CHIP are more likely to receive vaccinations, have regular medical checkups, and avoid preventable childhood illnesses. So, Mr. President, just let me conclude with this thought. We know we have to find savings. We know we have to work towards a fiscally responsible budget. I don't believe, and I don't think anyone here believes, that the way to do that is to do it on the backs of children who are poor but receive good health care through Medicaid. Do it by way of short-circuiting or limiting substantially the opportunities that older citizens have to go to a nursing home. Everyone in this building knows someone who's in a nursing home solely because of Medicaid. Not everyone, but plenty of people that we know, either people that we know and love or people that we know and encounter during the course of a year. So if you care about pregnant women, if you care about kids, if you care about older citizens and individuals with disabilities, you will think long and hard before you vote to substantially cut, as this budget does, Medicaid. And with that, Mr. President, I would yield the floor.